Hi, I'm Dr. Silva, and this video is just a coda to the Trazodone video. So if you haven't watched that one yet, please watch that one first. It really contains more of the basic information about what Trazodone is, an old antidepressant approved by the FDA for major depressive disorder, which is used as a hypnotic agent. It's used as a sleeping pill these days and not for depression. Although, it is an antidepressant, so the more the better. If you add it to an antidepressant as a sleeping pill, it's a great choice because it's not habit forming, and the more antidepressants you have, the better. But I wanted to record this follow-up because I neglected to mention two side effects, one which is fairly common and one which is maybe not so common but very interesting. And if patients have experienced it, they should know that it is the medication and that it's benign. In the first video, I talked about orthostasis, orthostatic hypotension, how Trazodone can make you very dizzy if you stand up too quickly. That's a very common side effect. It can be a very important one because it can lead to falls. So please do watch that video. I also talked about priapism, which is a very rare side effect. It occurs in men, and you can get, again, more information in the first video. So I talked about a very common side effect and a very rare side effect. The other side effects are non-specific. Dry mouth, constipation, nausea, those things can be caused, but Trazodone is very well tolerated. And really, orthostasis is the thing you mainly have to worry about. In this video, I just want to talk about one side effect that's very common, which is nasal congestion. I actually experienced it myself, and it was so significant that I had to stop taking the medication. Now, granted, I violated my own rule. I would have told the patient, stick with it, maybe modulate the dose, lower the dose a little bit, treat the congestion, see if it gets better. So I gave up very quickly, but it was so significant that I had to mouth breathe, and I actually had to get up and I used nasal spray and I had to mouth breathe that night. I couldn't sleep because I was so congested. It was very uncomfortable. Again, I didn't give it much of a chance, but it's probably due to Trazodone's moderate antihistaminergic effect and low anticholinergic effect. So it blocks muscarinic acetylcholine receptors as well as H1 histamine receptors. And in a lot of people, you get this nasal congestion that's pretty significant. One of the more rare side effects, but very interesting, is a phenomenon called palinopsia, from the Greek palin, again, and opsia, seeing. And what that is are visual tracers. Just like you might experience on LSD or mescaline or psilocybin, the psychoactive ingredient in magic mushrooms, or for some people, marijuana. That's not so common, but also migraine sufferers can experience it, and it can be part of the aura of a seizure, and there's lots of other neurologic conditions that can cause it. But there are two kinds, hallucinatory and illusory, and the kind that's caused by medications like Trazodone is illusory palinopsia. And so what you see is the persistence or reappearance of an image or a recently viewed object. And it's almost certainly due to antagonism, blockade of the 5-HT2 receptor. Because other medications that also block that receptor, like mirtazapine and Trazodone, Trazodone, which was removed from the market for another reason, and Risperdal, which ironically is an antipsychotic agent that blocks dopamine that's supposed to block hallucinations. These are not hallucinations, they are illusions. There is a stimulus. So the difference between a hallucination and an illusion is a hallucination is where you see something that's not there, you have a sense, perception, be it visual or auditory or olfactory even, that is coming from no stimulus. There is no stimulus. It's your brain doing it on its own. Versus an illusion, which there is a stimulus, there is light hitting your eye, there is an object, but you're misperceiving that stimulus. So seeing something in the dark, patterns and images and that sort of thing. And so when you take a medication that blocks the 2A receptor, then you might have this tracer phenomenon where you see after images. And it's benign. It's interesting. It can be a little disconcerting. It stops when you stop taking the medication. I don't know what the incidence is, but patients never complain about it to me. So if they experience it, either it's so mild that they barely notice, or they just don't tie it into the medication that they're taking. And it probably just resolves on its own pretty quickly. It is dose dependent, and it's nothing to worry about. But I thought those two were interesting. There should be a link here to the first video so that you can learn a little bit more about what Trazodone is and how we use it. Thanks for watching.